Good evening, everyone. Welcome and thank you for tuning in to the latest edition of the MSR Bulletin, where we are popping up with short, candid discussions on hot button topics in the community. Again, I am Stefanetta Harmon, and tonight we are going to be talking about the ongoing controversies and conversations around COVID-19. It's been more than a year into this pandemic, and vaccines are readily available, and just about everyone is experiencing some sort of social distancing fatigue. But with just 38% of the US being vaccinated, nearly 43% in Minnesota, we're wondering now, are we out of the clear? Are we in the clear yet? And that just depends on who's got the mic and who you're talking to. The Centers for Disease Control and Prevention, they have eased the mask wearing guidances, but they have varying rules depending on the location and whether someone is fully vaccinated. We know that Governor Tim Walz is going to ease the mandates in July. And so instead of just trying to figure out what happens next and watching SNL skits with varying degrees of information, let's talk to a doctor, Dr. Zeke McKinney. How you doing? Who can break down.
Thank you for having me.
Thank you so much. It's so much going on right now, right? Every time you turn on the news, you're like, wait, who did it? Who shot what? Literally. And so we just wanted to get a sense from you in the work that you're doing, especially, of course, you were over the AstraZeneca trials, right?
Still am,
right? He's like, it's still right. The fact that that's still ongoing is a whole other conversation.
Don't even get me started about that.
So we're going to be talking with Dr. Zeke McKinney, who is over at MD Health Partners and Park Nicollet, right? And just talk about what's going on. What should we be looking for, talking about, understanding? Because it feels like a hot mess.
It is a hot mess. Nobody was as surprised as I was about the change in guidance. I mean, no, let's be real about it. First of all, I'll give you all a plug. I just got an article come out in Minnesota Spokesman-Recorder. I think it's going to be online, maybe even today, talking about this exact issue. So you can read it there, but I'll tell you what's up.
Yeah, let's talk now. Let's talk now.
Let's just put it up on the screen. No, I'm just kidding. So here's the good news. I'll start off on a positive note. The fact that the CDC felt strongly enough to issue this level of guidance where, you know what, if you're fully vaccinated, just forget the masks. It's all over and done with. You can go out there and be crazy. It's good because it actually is supportive of how much increasing evidence there is that these vaccines work. They work in terms of prevention of disease. They work in terms of preventing the spread of disease. They work in preventing severe disease. And they even work against the variants for the most part. So overall, this is really, really, really good news. But here's the bad news. Ain't everybody vaccinated yet. I mean, look, in Minnesota, as of right this moment, we're at 54.7% of Minnesotans completely vaccinated. And let's get more real about it. We know within certain communities and certain pockets of Minnesota, that rate's going to be a lot lower. And I suspect, I don't know for sure, that in our Black communities, that is going to be a bit lower. And that's why I'm worried, because now that we've sort of said, okay, well, masks off, everybody, and that's no longer the norm, there are going to be people rolling around totally cavalier, not wearing masks, which I guess, again, is fine, except we don't know who's vaccinated and who ain't. People don't have it tattooed on their forehead, and I don't know if I want them to.
You want a scarlet letter?
Exactly. But at the end of the day, it's like, who's going to be the next patient zero around here? I mean, the bad news is what we've seen going on in India, where vaccination rates were really low, and not because people weren't interested, but just because they didn't have the availability we had here in the, highly industrialized, affluent United States. Inversely, we also have seen that, with the spread of disease there, now they have a new variant, the India variant, V1617. And they think that's part of the reason that the rates of disease are so high there. But it all started because a couple months ago, they noticed that rates were low. People were having all this pandemic fatigue, and they eased up on restrictions. Now, on the bright side, we're probably not going to see an outbreak like that here with, however many percent vaccinated, even in Minnesota. But there still is the opportunity for the spread to happen and for new variants to develop. And I can assure you, I don't want the North Minneapolis variant to come out of this when, we weren't being careful enough. And so that's what scares me to death. And then even on top of that, we still got plenty of people who can't get vaccinated, the kids under 12. And for me, that's all of my kids, to be honest.
Right.
And so you're going to still see me wearing a mask and still see me being careful because this ain't going nowhere yet.
It almost feels like a shaming at this point, right? So, there's a group of folks who weren't wearing the mask to begin with. Vaccine or no vaccine, whatever happened 6 months ago, they just not wearing a mask. And we've seen those fights on the news about that. And so there's that group of people that are now empowered. Well, you don't know if I took the vaccine or not. And so how does that work? I go into a store and now there's an honor system. Are we walking around? Are they calling? Well, what do you think? Like, should there be vaccine, like passports, identification cards? Like, what do we do at this point? Because I can see not just saying, hey, I took the vaccine. I can see someone saying you didn't take the vaccine, and now they're going toe to toe. And how do you do this?
Man, there's so much to unpack in what you just said, but let's start with the shaming issue. Now, as a doctor, I'm going to be really upfront and say, look, I am never in support of shaming people about their health choices. Like, that's just not the way to get things done. I don't think it helps build relationships. Doesn't help to build a sense of community. And so let's not approach it from that way. Mm-hmm. I think the concern that people have about taking vaccines are very real, and we have to acknowledge that. And people like me have to help figure out, okay, what is it that I can help to tell you to help you overcome whatever your concerns are. Mm-hmm. And so that's real. So I don't want to shame anybody. This issue of vaccine passports, oh my goodness, that's a whole nother layer to unpack. So they've talked about that in places like New York. Okay, well, now you can go to Madison Square Garden if you got this vaccine passport. But what do we know when you start giving people differential access to things? People who are underserved, communities of color, are number one going to be the people left behind, and I ain't playing that game. However, I also don't want to get into this world where we're on the honor system, because we've already seen in public health.
There ain't no honor.
There ain't no honor. I hate to say it, but it's true. So where is the balance of this? Well, look, at the end of the day, nobody's stopping you from wearing a mask. And to be honest, me, Dr. Zeke, hitting the street, I don't like nobody to know me. I'm happy to wear a mask. I'm on the low. Y'all can't see me. But even still, I also want to wear a mask to be a good example in the community that, again, this isn't over. I still have people in my house who can get COVID, my kids namely. And there are still people who can't get the vaccine because maybe they have severe allergic reactions, or maybe people have issues with their immune system where the vaccine isn't just going to work for them. And so much like with the flu and other issues of vaccination, we got to protect everybody around us. It's not just about, all about me.
Mm-hmm. So you sound very sane.
I mean, only sometimes.
In this conversation, but what do we say? Okay, so let me start before I get into this again. For those who are just tuning in, I just want to say thank you for this conversation. We're talking with Dr. Zeke McKinney, who is an occupational medicine specialist for Health Partners. He does a lot. Chief medical editor of Minnesota Medicine, and for tonight, he's also head over the AstraZeneca vaccine trials locally, right? And giving us some insight on what we should be looking for, discussing, and thinking about in terms of vaccines and wearing masks and how we keep our communities healthy and safe. So if you've got any questions, please drop them into the comments. We are here for them all. And Dr. Zeke is going to give it to us straight, right?
You know me, I try to keep it all the way real.
All the way real. So, okay, I see that you are concerned about your kids, right? What does that look like, though, when you go into open spaces and other people aren't wearing masks, but you're vaccinated, you've been long time vaccinated. And we know you still alive, you still got your color. So you're
first of all, I was like way up front getting vaccinated. I got vaccinated the same day as Joe Biden. So y'all didn't think they gave some black people access. Hey, I was there, but I'm just kidding. That's because I'm seeing COVID people with the trial. No, so actually I had a real experience of this yesterday, Stephanie. Mm-hmm. I went to a business because, as part of my job as a work doctor, sometimes I got to go on site and look at stuff. And I haven't done this in forever. So they invited me over there, and I go and wear my mask. And they on the door said, wear masks. And homeboy at the front desk is not wearing a mask. And he says, hey, if you're not comfortable wearing a mask, you don't have to wear one here. Everybody in this building is vaccinated. And I said, I'm still pretty comfortable wearing a mask. So then I roll up into this conference room, and there's like 8 cats in there, and ain't none of them wearing a mask. And so I said to the dude, because I don't want to be like weird and off-putting. I says, hey man, is this not kidding? Like, is everybody in this building truly vaccinated? He said, yeah. So I said, fine, I'll take it off. Now, I can't deny that there was still a little bit of anxiety in me, but it was actually a really weird experience because I haven't been in the room with people like that in forever.
I've seen their faces.
Now, that's a controlled environment. Like, again, very small company, a very like little meeting I'm in. It's not the same as going to Target or, being sitting next to somebody at the Timberwolves game or whatever. Look, from day one, I'm as draconian as they come. I haven't been on a plane. I ain't been to eat nowhere. I ain't even been to eat on a patio. I'll take out food and maybe not even that much. Do I think everyone has to adhere to my trying to be as tight about this as possible? No, I don't. But I do think we also still exercise caution. I mean, look, going to Target, your exposure was already pretty low. I mean, you're not up in somebody's face. It's a really big space. They got pretty decent ventilation. But I'm just saying we all need to still support each other and wear masks because you don't know who's vaccinated. You don't know who got kids at home, and kids are going to school. Somebody in the chat here saying, well, my daughter plays soccer. We were told we should get tested weekly. Can you do that after all vaccinated? I will make it really easy for you. No, if you're all vaccinated, you absolutely do not need to get tested, period. That game's over. And congratulations. I'm glad you and your family has been able to get vaccinated. Like I said, my kids ain't old enough yet, and we'll see that maybe in the next 6 to 12 months.
She didn't say that they were vaccinated. She just said, should they continue to do
after they're vaccinated, we're fine. Yeah, whether you are or aren't, once you are vaccinated, no, there's no need to continue to get tested. So that's actually a bonus.
Okay.
So here's the thing. If y'all needed proof that these vaccines work, the fact that the CDC went at it this hard is about as good a proof as you're ever going to get.
So if I've got the vaccine and maybe I've also tested for antibodies, if I've caught it before, I don't have to wear a mask and I don't have to worry about that. Period, point blank.
So digesting the antibody data, I can get into it, but that may be a little bit beyond this conversation.
Okay.
Suffice it to say, you've been vaccinated. You're 2 weeks out from your final dose, whether it's one with Johnson & Johnson, 2 with the other vaccines. Do you have to wear a mask? No. Generally speaking, the risk to you is exceedingly low. Okay. But like I said, I am not supporting this. Let's go around on the honor system and give total, full blown rights to everybody who's deciding not to get vaccinated, decided not to play along with this the whole time. That isn't going to help. And again, we can still have variants develop. That is the thing that I am so scared of. Believe it or not, Stephanie, I don't know if you know this. So right now in the United States and in Minnesota, the number one strain of the virus going around is not what we've seen at the beginning. It's the UK variant. It's like 75% or greater. So we know variants have already come into the US and it's going to keep on happening, but we got to keep being careful. We're like approaching the red zone here. If everybody would just hold it down a little bit more. Just
a couple more weeks or a month or so. So if I've got more, look, you got to get us starting somewhere. We got to think, baby steps. But thinking about that, then, so I wear the mask. If I've got the vaccine, is it possible? Because this is a common conversation in communities, right? Can I give it to somebody else and not have symptoms because I've got the vaccine?
So let's be all the way real about it. Does the vaccine prevent you from getting COVID? The answer is absolutely. It does not prevent you from getting COVID. It mostly prevents you. But, we've seen breakthrough cases here in Minnesota. I haven't even seen them in the trial. Probably of the 2.5 million people that have gotten COVID vaccines here in Minnesota, we're looking at, this is just a guess because MDH doesn't update this all the time and they have to look into the cases, but around 1,000 breakthrough cases. Now, people are like, oh my gosh, 1,000, that sounds all right. Well, no, if you think about 1,000 out of 2.5 million, that ain't nothing.
Right.
And to be fair, there have been people who died having had the vaccine and got COVID. Again, we're talking on the order of 5 to 10 people. Okay. So again, 5 to 10 people out of 2.5 million, not a big number. You don't want to be that person. But my point is this, the risk is still there. You can still get COVID. Now, with that same risk, you can still transmit COVID. It's very unlikely, but you can do it. Okay. And so this is exactly why I am not giving up the fight yet, and especially because I got people in my house who still aren't vaccinated. It's just not worth it to me. I mean, I've made it this far with 5 out of 5 people in my house not getting COVID as far as I can tell.
We're going to knock on everything.
I'm playing that.
Okay. All right. So we got that piece, right? Now, let's come back to the Black community because I'm chilling here in Dallas and I see every other commercial that even caters to, for any show that caters to Black folk, there's a commercial that says, hey, we know that they messed up back in the day AKA Tuskegee, but it's safe now. And it's funny, like that commercial that it just starts off with like, we know that there's a history, but don't let it ruin your present and your future. How do we have that conversation with folks who aren't taking it for that reason? Because they're just like, well, you know what happened last time.
Yeah, no, that's a great question and a topic I love. So first of all, full disclosure, you might see some commercials with me like that up here in Minnesota. MDH has found your buddy Zeke, and so if you see me, don't be mad about it, because I'm just singing the same song I'm singing here. Okay, so here's what I'll say about Tuskegee, and this is a real thing, and I'm not denying that at all. That was a major atrocity, one of probably the most significant research atrocities in the history of the world, and certainly in the history of Black people. What people don't know, and the story they don't like to tell, or I don't know if they don't like to tell it, maybe people just don't know it, is that the outrage that came out of the public finding out about Tuskegee led to major research protections here in the United States that exist to this day. So it started with the National Research Act in 1978, the establishment of institutional review boards, or what are called IRBs. And so those are independent scientists and independent people in the community who oversee any research project, unless it's a totally bootleg place trying to do it. And essentially at the beginning, they have to review it and make sure the risk of harm to people is very low or minimal or non-existent, and balanced with whatever the potential benefit of the research is. You can't just study any old thing you want. Vulnerable groups are protected. You can't do research in children unless you really have to do it in that population. And even then, that risk-benefit calculus has to be even better. Prisoners, same thing. You can't take vulnerable populations. So, I mean, that's a huge thing. So all that came out of this was, number one, research is voluntary. Two, we need to oversee research with these IRBs. Number three, you can't coerce people to do research. Like if I said, oh, come join my AstraZeneca trial, I'll give you $1 million. Well, everybody would want to do that. That's not ethical. In fact, so for this trial, we give people $100 per visit. Ain't nobody quitting their full-time job over it. And probably if you didn't want to do it, it ain't convincing you to do it. But if you did want to do it, we're paying you for your time to be there. And so it's like all these protections that never existed before all came out because of Tuskegee. And so in the same way, like I would say, you know, I wish it didn't take Tuskegee for that to happen. And I wish it didn't take George Floyd dying for people to care that Black Lives Matter. Well, there are silver linings to these things. And I wish it didn't take a pandemic to make people wash their hands when they come out of the bathroom. People nasty, man.
Every time we see the commercials for washing, what y'all been doing for the past? What? You weren't. I mean, I may not have been singing for as long as Dr. Crutchfield was telling us to sing. I wasn't singing a whole birthday song. But definitely, you know, going in on the washing of hands. And then what do you say? You know, so there's that part. We get that. We're not being researched on like that, you know, that's not happening. No. What about the conversation of, you know, I don't want to say the ghetto-ness of it all, but like, so the idea that they are pushing certain vaccines into certain communities, and then that makes people question, should they be getting it? Just, you know, is it one dose? What makes this one different? How come it seems to be, this is what they're pushing in this community, and this community is getting a different vaccine?
So I don't know if there's necessarily evidence of that, but that might be the appearance. And I will tell you this, I mean, for people who may be hesitating to get one or deliberating on it, the one dose vaccine is a good option because it's like one and done. You ain't got to try to fight people to come back and get their second one. You know, like that's, I think, a good rationale. And it is what it is. To bring it back to basics. So why is there a one dose one versus a 2-dose one? That's just about how they set up their studies and what they were trying to aim at getting at. Are there, you know, is it better to get a 2-dose and a 1-dose? I mean, maybe a little, but at the end of the day, they all work. And
which one's better?
So here's what I'm going to tell you. We don't know yet, because there might be that some are better for people with diabetes, or some are better in older people versus younger people. They haven't been out long enough for us to know to that degree. But if the question is, do they work? I mean, yeah. The FDA set a bar of 50% at the beginning of all this. I don't know if y'all remember. And all of these are way better than that. And all of them, as far as preventing severe disease, hospitalization, and death, are like upwards of 99%. So, I mean, that's about as good of a vaccine they're ever going to see. This whole story of how fast these vaccines came out, while it's scary to people, and they're like, oh my gosh, should we do this as fast? It's actually a miracle of modern science that we were able to get this done. And I think people should be celebrating that, to be honest, because quite frankly, I mean, the way people are moving around the globe, the way the world has gotten smaller over the last 100 years, I'm thankful we haven't seen it be as bad as it was back in, 1918.
Okay. So, what do you say for folks who are on the fence right now about getting the vaccine? I'm going to be honest. I'm like waiting. I asked you last time when we talked, when would we know like really good results on this? And you said September. And I was like, well, I'm just going to wait till September, right?
So you still
And
haven't gotten one?
I still haven't gotten one, but I'm just going to, that's me personally, but I am queen of a mask and around folks, who are moving properly. And, mask prevention is, I mean, unless you're doing something really stupid in rooms of, this close and, around that, for me personally, that's where I'm at. Right. But in general, I recommend folks. It's just me personally, that's where I'm at. But overall, what do you say to people who are on the fence, who are scared to take it, maybe because they're pregnant or allergies, or just anything, just because it's still so new to them?
Well, let's put a pin in pregnancy and allergies because I do want to talk about those, but I want to make it all the way like 100% personal. What are you waiting for, sister?
Me personally, for me, I have allergies. I'm allergic to the world. I get the tetanus shot and my whole everything closed up. So when they first started talking about the vaccine and it was like there were allergies present and anything to do with my I forgot what it's called, but anaphylactic shock, that's me. That's me all day. That's me from a bee sting. That's me from everything. So that's been my number one thing. Like, all right, let me wait to see what that is looking like for folks with allergies. So I'm on the allergy side all day long related to that. So that's been my number one piece. As soon as you said that, I'm like, I don't need my throat closing today. I don't. And I have a delayed reaction. I'm not one of those people immediately. I'm good. So let me wait. And so let's talk about it. For those with allergies, what do you say to us to get us to wait to move before September?
Real fear about this. I mean, that's a real thing to be concerned about. Like, I mean, vaccines or like anything can have allergies. And so that's the number one reason people may not be able to get this, or in fact should be a little bit hesitant. And I would tell you, don't get it at CVS. You want to be like
right, I want to be at the hospital.
So if God forbid something happens, they can be ready. And honestly, right, the protocol is to have people wait 15 minutes, maybe even 30 minutes. Somebody like you, if you're worried about a delayed reaction, you hang out at the clinic for a couple hours.
Yeah,
that's not that big a deal. But make sure they know you have that history going into it. And that's about the best you can do. Have an EpiPen ready. I mean, you can preload with some Benadryl if you want. I mean, it ain't going to hurt. I'll tell you that.
Okay.
But at the end of the day, that is a real concern and something, but it's something that's avoidable. And again, the risk of COVID is so much greater than all these other things.
Right. Okay. So for the folks with allergies like myself, exercise caution, but also go to the hospital. Don't go to the CVS. There's no way I'd be at the CVS with it. Because as soon as you start to feel that your throat close, it's a wrap. It's a panicky. It's very panicky. And if I've experienced that from a tetanus shot, which I needed, do you know what I mean? After getting cut. So I do understand the risks of like, you still need this shot and we'll figure out and stab you with whatever else we need to stab you with afterwards.
So make sure they have epinephrine off and EpiPen. And I mean, seriously, like, it's as simple as that. Or ask them, hey, what's your protocol if someone has a severe anaphylactic reaction? And make sure you're comfortable with what that protocol is.
Okay.
I mean, if you know exactly what you respond to, you can look at the ingredients in these vaccines, and I can happily put a list together for you. But at the end of the day, some people, we just don't know. And that's always why you got to be careful. I mean, so again, allergy is the real caution one. Everything else I'm not as worried about, to be honest.
Okay. I'm allergic to dust, okay? If I touch dust, it's like, oh, are you welting today? That's great. No, seriously, it's dermatography, something where you can literally write on. Yeah, no, I'm that person. Yeah, so I'm super gonna wait, just gonna wait.
You need to come see me in my environmental exposures clinic. That's what we about.
Let's look. Don't be surprised if I show up one day, because I would get those allergen tests and one day they would all react, and another day only half of them would react.
Oh, we don't.
Yeah, it's crazy. But we're not talking enough about me. Let's move on. So let's talk about
pregnancy then.
Yes, pregnancy.
Unless you're pregnant.
No.
All right, so that's been a concern. No, seriously, and even let's actually step it back to what you hear everybody talking about: this concern of infertility. So there's absolutely no data to support that whatsoever. That's just internet hype. I don't know what to tell y'all now. What I can say is we know pregnant women who have gotten the vaccine I know of pregnant women who's gotten the vaccine and had babies. So, I mean, if it was going to make people infertile, you would have already seen a ton of cases of that because people are getting it. And by the way, COVID is more severe if you're pregnant. So that's actually probably more of a reason to get the vaccine if you're pregnant. But I'll give you some good news. There's been some studies coming out showing that there is some transmission of antibodies through breastfeeding. So there you can protect your baby by being vaccinated. And that's good news.
Okay.
So, I mean, you know, again, babies are going to be part of that group who right now ain't getting vaccinated. And who, by the way, we don't want to potentially have some long-term consequences of them getting the disease. That's scary to me.
Right, to be born with it and to move forward with that. Now, speaking of pregnancies, there's also the conversation about even women's menstrual cycles being affected. Now, I've seen that all through Facebook. Now, is that true? Not true?
I'm going to tell you that actually is probably closer to true.
Oh, okay.
Now, the challenge is this is an area of medicine, much like environmental exposures, where we don't have perfect science. Like, there are things that can affect different aspects of our hormone systems in our body, and I don't think we have a good feel on what that is. What I can say is, from enough anecdotal reports, we are starting to see that there's probably some truth to that. I mean, and it doesn't appear to be a long-term issue. It's just like I've heard about women getting their period earlier than they would expect, or suddenly after getting the vaccine, and maybe it's heavier than they would expect, or something like that. And again, that's not insignificant. I'm not saying it's nothing, but again, compared to getting COVID, it's closer to nothing.
Yeah.
And the bigger concern is, you know, is that a long-term thing? And there isn't evidence of that. But the good news is, like, studies are starting to be done about this exact thing because, you know, for the longest time, people were not taking women seriously about that. They're like, oh, that's not a thing. That can't be possible. And you know what? I just honestly, this is the one time where I will criticize doctors. I hate when we say that because if we base everything on, you know, what we already know must be true and nothing else can be true, man, we're losing sight of so many different things, and COVID would have been one of them. Post-acute COVID syndrome, the long haulers, that doesn't fit any picture of what we know in medicine so far.
Wow. Yes, I have a couple friends who have long-term, still breathing through those machines and cough. I'm just like, wow, it's been 6 months, boo.
No, but not even that. The people who had mild COVID got better and then started having like weird kind of longer-term illness. That stuff is scary, and I've seen a lot of people who have not been able to go back to work for a while because of that.
Right. No, that puts people like me on edge all day long.
Yeah, but here's the thing. If you're scared about that, then you should be more in favor of getting the vaccine.
I know it's this catch-22. Like, well, you know what's going to happen if you do this and sit here and then maybe just make them give you something anyway. Stab you a couple times with something else before you leave. No, that's a real conversation. And then, so we're getting, you know, folks are getting vaccines now, you know, past couple months. Do they have to go back in 6 months? Like, what does that look like? How, like, is this
That's
like
a great
the flu?
question too. Yeah, so it seems highly likely that a booster is going to be needed. So the good news on vaccines versus disease, because, you know, people were asking back in the day, like 6 months ago,
Right.
Well, why don't we just get the disease and be immune that way? Because to be honest, immunity from the disease lasts 2 or 3 months, period. And right now we're seeing the data from Pfizer and Moderna that they're lasting, at least so far, greater than 6 months.
Okay.
I think based on all available evidence of what we know about vaccines like this and diseases like this, immunity is probably going to last somewhere on the order of 9 to 12 months. So much like the flu shot, you might have to just get one every year. That's my guess. We just really don't know yet. But we do know 6 months so far, which is pretty good.
Y'all gonna be able to mash it up where you get the flu and the COVID shot at the same time?
Oh, I'm with that, man.
Like, what happens next? I mean, to me, that's the real question. Like, because it just feels like one more process or one more thing, and then where are they available in the community, and then who goes for it? So I think that would be really good to explore in 6 months and to tell folks that. And then how do you get a reminder from your doctor? What if you went to one of those pop-up places? Like, how do you know?
That's going to be the trick. And I mean, you know, to be honest, I have been an advocate for people being more engaged in their own health and being more educated about themselves and their body for the history of time. And I feel like COVID has taught us even more how relevant and important that is. So we are seeing right now this transition from, you know, hey, go to your big box pop-up site, you know, everybody's getting vaccinated here, to like, it's being distributed now in normal clinics. You go see a regular doctor, you go see a work doctor like me or something, and I'm like, hey, did you get a vaccine? Pretty soon, if not already, we can offer it to you right there on the spot. Supply is at this moment starting to outweigh demand.
Okay.
And so I think it's going to be integrated more and more into our processes, but it is going to be up to you. And eventually we'll have ways of even, checking people more consistently for antibodies. Because right now they'll tell you the antibody tests are not going to be a good enough measure of whether or not you truly are immune. And I agree with that. We just don't have enough science on it yet.
Okay. And then I know I don't want to take this too long, but just folks, again, if you're tuning in, we are speaking with Dr. Zeke McKinney, occupational medicine specialist for Health Partners, Park Nicollet, and he is also head over the AstraZeneca trials and answering all our questions about COVID-19 and mask wearing and just getting into all the nitty gritty controversies that we talk about on Facebook and in our houses, but don't really talk to doctors about. So this is a great conversation. If you've got a comment or question, please drop it in. I do want to go back to the conversation about strains, right?
Oh, yeah.
75% you said UK strain. We got the Indian strain that's gonna make it here some way or another. Is it showing right now that it's any worse or more contagious, or is it just another mutation?
That's the part that they're concerned about, but I don't think we have perfect data on it yet. The concern is that it may be driving infection rates in India. There are some people who argue, you know what, there's plenty of evidence that there are actually other strains driving rates in India as well. But suffice it to say, that's been the concern all along. If we get enough mutations of this virus, it's not going to work against the vaccine is not going to work against it, or it's going to be more infectious. That is, you're more likely to spread it or to get it. It might be more deadly. You're more likely to get severe disease and die. That's all the things we're concerned about. And unfortunately, you can't predict that. I mean, look, let's take it all the way back to basics. Let's talk about the flu again. So why do we have to get a flu shot every year? And how does that work? So the flu is a really fast mutating virus, so fast that year to year, the strains of what we're seeing are actually different than the year before. And they actually base the vaccine for a current year on what the strains were the last year. And the bad news is that tends to be about, 30, 40, 50, 60% effective because we're not matching it up right. It's strongly believed that we will see less severe disease by getting a vaccine, even if it's not perfect match for the strains. But at the end of the day, it's not going to be a perfect fit. And so, right now I can tell you the COVID vaccines are better than the flu vaccines. And COVID doesn't mutate as fast as flu, except for the fact that so many people got it and it's spreading so fast that we're seeing these variants come up even quicker.
Wow. Okay. So the booster shots then, looking at those strains and the change. And so will these booster shots take into account these new variants, or would we be just going back and getting kind of a booster of the same shot? I don't know how the vaccine situation works. Are you guys constantly redeveloping the vaccine?
They will be if they aren't already. And so
okay.
I'm trying to think of the right way to answer this without getting too complicated, but there's definitely been interest in making vaccines for COVID that are more broadly covering, what we'll see with the different types of variants. And so there's kind of work being done in that domain. There's also work, I think, being done in redeveloping the existing vaccines to be more protective against the variants that are coming out. And so much to the same point of people being fearful about how fast these vaccines were developed. Well, the good news is basing vaccines on this type of genetic material, the way they work, DNA, RNA, allows you to make the vaccines more quickly because you don't have to reproduce as much of the virus to get so many vaccines out there. And so similarly, it means in the manufacturing and development process of these new sort of, let's say, remodeled vaccines, it's going to happen fast too. So, I mean, all this is reassuring to me in the sense that we have really good science and really good technology right now to get on top of this stuff. Is it perfect? No. Are we still learning a lot as we go? Yep. But at the end of the day, I think we can beat this thing. It just has to really involve people taking it seriously and taking science seriously.
Okay. We have a comment that sounds like a lot of us, especially in the Black community. I haven't had a flu shot since. And so this one is since 9th grade, and he's 32 on Saturday. What is the story for those folks who just haven't had the flu, and now they're transferring it to the same conversation about, well, I'm just not getting the COVID-19.
Yeah, no, and I mean, you hear this story all the time. And one of the reasons I think people don't want to get a flu shot is because they end up having some side effects and feeling sick for a day or two. But again, let me assure you, real flu, not when we talk about stomach flu, which isn't really a thing. It's just like that's a stomach bug. Or just saying you have a cold and saying you have the flu, that's not the same thing. I mean, real influenza,
You feel like you're dying.
Really sick. I mean, you have fevers, your body hurts, you in bed. So flu is a bad illness, no question. And it kills people every year. In fact, this year was particularly interesting that we only had like a really low number of people hospitalized and died from flu because we were all kind of holding it down this winter, wearing masks and not going outside. But back to the point of what am I doing or why am I not getting the flu if, in fact, I'm not getting a vaccine? Well, here's the thing. The flu is most dangerous for little kids, like babies, and much older people. And so somebody like me or this person who's 32, I'm in my 30s, despite this gray hair, believe it or not, even if I didn't get a flu vaccine, it's unlikely that I will get severely ill from it. It's possible, but unlikely. However, I could be, much like with COVID, an asymptomatic carrier, go hang out with my parents, dun, 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 then they run into a problem. Or hang out with somebody's baby, and dun, 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 they get really sick. And so the flu is a perfect case study of actually why we all need to get vaccinated, because it's not about you. It's not about you 32 and healthy and ain't got no problems. It's about protecting all the people you're hanging out with and the people who can't get vaccinated even if they wanted to. And so COVID's the same deal. I mean, I'm making the same exact story about it. And somebody said, they said, very understandable. Thank you so much. Because look, I appreciate that people don't want to get needles stuck in their arm. I don't either. And trust me, I'm as scared of going to the doctor as anybody who's black. And it's like, I really feel that. If it's bad for me, I know it's bad for me. But I do believe in science. That's why I believe in this computer and Zoom and StreamYard and my phone working. I mean, I don't feel like we can take it and leave it with science. Like, well, sometimes I believe in science, sometimes I don't. Hey, man, you drive your car every day. If you don't believe in science, something's weird about that. But, it is what it is. And I understand this stuff is hard to interpret. So that's why I'm here trying to break it down as easy as I can. If you want to see me come down to the barbershop in my hoodie, hey, talk to Tito Wilson. We'll take it to the Situation Room. He wanted me to give him a shout out to you, Stephanie.
I love Tito. He's a bomb. He's like, look, come to my North Minneapolis shop. Let's go.
That's where I'll be at. Honestly, seriously, if people want to really come talk about it, I'll go down there and do it anytime. Y'all talk to me for real.
Okay. Couple more questions because I don't want to take too much of your time. But you just mentioned, you're a doctor, a black doctor, and you're getting the shot and you don't like shots. How do you, because my sister's a nurse and she's fighting having, she's, taking this shot as well, RN. Do you think all medical professionals need to get this vaccine? And then what does that look like for them? Like, at what point does it become a mandate versus just an emergency, allowability?
Yeah, that's actually a really complex occupational health question. And, this has come up with flu before, where people say, oh, flu shots should be mandatory for healthcare professionals. And some people say, no, it shouldn't. It's a choice and I should be able to do what I want. I mean, honestly, I don't know that I can give you the right answer to this question because it depends on what we as a society feel is the importance of public health. And so just like right now, should it be mandatory for you to get the COVID vaccine to go to school? Should it be mandatory for you to get the COVID vaccine to go to work? Should it be mandatory for you to get the COVID vaccine to go to see the Twins play? I don't know. I mean, if you ask Zeke McKinney, yeah, I think we should all have to get it. But at the same time, I also do respect people's individual right to make health choices for themselves. However, in most cases, it don't affect other people. If you choose not to take your blood pressure medication, that ain't hurting me or Stefanetta. But at the same time, if we're not getting the flu vaccine, we're not getting the COVID vaccine, we can be doing harm to other people. And in the healthcare setting, that potential is even greater. However, in the healthcare setting, we also have really good personal protective equipment. So even in the absence of vaccines, we have a reduced likelihood of spreading disease. But does that mean it should be necessary? I don't know. It's a tough question. Everyone's going to hate me no matter what answer I give to this. But I'm just going to tell you, I do think it is very important. And I wish I could have an individual conversation with every single person who's hesitant to help address some of these concerns, because all the good you're doing as a nurse out in public, I think is amplified if you are vaccinated and setting that example for others too.
I know when I worked in the health environment, I'm not a healthcare provider at all, but when I worked at North Point, we were all required to have a certain series of shots just for working within the building. And I mean, it's just part of, like, if you took the job, you knew where you were working. I think that's part of the conversation. But yeah, so
well, I want to hit you on that point. So the reason some vaccines are for sure required, and the big ones would be hepatitis B, for example. because that's a bloodborne pathogen. So if you're, let's say, drawing blood from a patient who has hepatitis B, and then you accidentally stick yourself, again, speaking to my specialty occupational health, you have some likelihood of getting that disease from that needle stick. And so because your job smartly doesn't want to lose you as an employee or have a big work comp case, hey man, you got to get vaccinated. We can fight that one easy. And so it's, I think, the same sort of physics, but honestly, it really varies how different institutions are going to handle it. And we haven't nailed this down even in my specialty as to what our stance is on this yet, because we've been arguing about this with flu vaccines for a long time too.
That's good to know, because just sitting with that, like you just sit that back, you hear those conversations going back and forth. And I didn't know that you guys were also having those same battles where you are about like, well, should we have it? Should we not have it? So throughout this whole conversation, what's the most important thing you want us to walk away with understanding?
The vaccines are the best weapon we have against this pandemic. And so if you're tired of being at home and you're tired of not going to the club and you're tired of not hanging out with your friends and your family, this is the way to do it. And they already told you, that's like, hey, you get a vaccine. They are telling you from the CDC on high that that's about as good as it's going to get. Now, does that mean we can't or shouldn't stop wearing masks? Well, see, that's where I'm in a point of disagreement. I'm saying for the moment, until we get some huge mass of people in the United States vaccinated, I think it's unsafe to really pull up on the restrictions this fast. And especially because we know there are still pockets of communities that are just completely way underrepresented as far as vaccination.
Now, what percentage do you think? Do you think it's that 85% or of people being like herd immunity for, the country?
Well, you said a bad word. I don't like herd immunity. So community immunity nowadays. Look,
community immunity?
Black people don't want to be guinea pigs. I also don't want them to feel like animals when we talk about herd immunity. We talk about community immunity. Okay. How do we get us all? And it rhymes, so it's fun too. But yeah, it differs for each disease and how infectious it is. And with different variants of COVID being differentially infectious, there's no right answer. The number probably is 75 to 95%. I'm not going to tell you where. But honestly, if we hit like 95%, then I'm going to say for sure, yeah, like, go ahead, take off your mask. It don't matter at this point. Because really, the whole point of community immunity is the virus don't got nowhere to travel. Oh, look, somebody has it, but they're surrounded by 10 people who are all vaccinated. The virus is like, oh, no, I want to get down and copy and replicate. And can't do it. You're done, buddy. And so that's what we're trying to do, paint this thing into a corner so then it dies off. And then the variants aren't coming up and we can finally be over this whole thing. And to be fair, I mean, look, from day one, if we all just locked ourselves in our houses for like 4 weeks, everybody in the United States, it wouldn't have come up. But nobody was prepared to do that. And we probably didn't have the supply chain to do it either. I mean, we're probably better prepared now than we were then. Maybe the next pandemic will be even more prepared to do it. But at the end of the day, in America, we believe in personal freedom, meaning it doesn't really matter what's going on in society. You do whatever you feel like. I don't know that I agree with that, but what? That's how we feel about things. Have you heard about the gun laws in this country? Come on, man.
Yes, I understand, but just sometimes I'm just like, if we could have just sat inside, we could have been outside playing already. If we could have just sat still and worn masks that's my personal take. I don't know. I'm not a scientist, but it just felt like y'all can't sit at home for 6 weeks.
Well, here's the thing. Look, I mean, I can't tell anybody how to live life, but I truly believe in my heart, part of the cost of living in society is that we owe something to other people. Look, sometimes you just got to wait in line. Sometimes you can't knock somebody upside the head because you don't like them. I mean, these are why we have rules and laws in society, so we can understand how to live together in harmony. So I don't know. That's a different issue than COVID that has been going on for a long time.
Understand.
What do we owe to each other?
So look, everyone, Dr. Zeke says mask up, regardless. Keep masking up until we reach this point of what I don't know. What you gonna come back and let us know when you don't think we should mask up?
I don't know if there's a magic answer, but here's the thing. I'll tell you what will show you the data. You'll see when rates start really dropping off. And deaths really start dropping off. I mean, look, they've gone down, no question. Vaccination has been successful thus far. Right. But it's like, there's still stuff happening. And so we just got to keep an eye on it. And so, yeah, I'm happy to give you the update, as much as you want me on here until y'all get tired of seeing my face. Okay.
Well, folks are going to ask other questions. They're coming in, what about this? And what about that? There's always a what about. So at this point, no matter what you're seeing in the new, in terms of the CDC reports about, easing the mandate, even Governor Walz has eased the mandate starting in July. The doctors are saying, like resoundingly across the country and locally as well, keep it on. You're not just protecting yourself, you're protecting the people in the community. So that's that. And then if the vaccine is for you, get that. Unless you have allergies, then go see a doctor. Don't take it at, like you said, CVS, and we'll just see what goes from there. But
how about this though? I'll give you something positive. So if you're vaccinated and you want to go visit your friend's family who's all vaccinated, yeah, you don't need masks. That is actually the case where this works.
Nice.
But what I'm saying is, when you start talking about bigger places, like, again, I'm just picking on, I don't know, the grocery store or Target or whatever, or, going to, Target Center, like, I don't know, man. I'm just not convinced yet. You're going to be seeing too many strangers, and you really don't know what people be into.
Yeah, like, I don't know these people. Sorry to this. Man, I don't know them. I feel like that in general anyway. So
well, that's why I like the mask personally. Then I really don't need to be up on people. Look, I'll just be to all the way real. The pandemic gave me the total excuse not to have people all up in my face, which I was happy about. So, whatever.
So that's dope. If you're all vaccinated, you guys can all live your happy lives outside in the world without a mask. But again, you still said wear the mask anyway, regardless, except if you're in your groups. So the conversation and the saga continues. If you've got more questions for Dr. Zeke McKinney, who is over at Health Partners and also head of the AstraZeneca vaccine trials, please drop them in the comments. He will answer them, and we'll be able to share with him and continue these conversations. And so thank you so much. I'm Stefanetta Harmon, and you have been tuned in to the MSR Bulletin. Thank you.